Well, I wear many hats at the clinic and the hospital, but one of my favorite hats to wear is when I'm an AME, or Aviation Medical Examiner. And what an Aviation Medical Examiner is a physician who does medical exams on behalf of the FAA to make sure a pilot is safe to be a pilot in command of an airplane. So every time before a pilot gets into a plane, they do a very careful pre-check of the plane to make sure that the aircraft is airworthy. My job as an AME is to make sure the pilot is airworthy and nothing bad will happen to them, or no foreseeable medical conditions would incapacitate them or make them where they were unsafe to pilot the plane. As an AME, there are two different classes of it. There's a basic AME and then there's a senior AME. And the senior AMEs are able to do flight physicals for class 1, 2, and 3, where a basic AME can do flight physicals for classes 2 and 3. There are only 4 senior AMEs in the state, and here in Brookings we are lucky to have 2 of those 4. So we do get lots of airmen from really all over the state, and actually I have had international pilots coming in that are coming to South Dakota for flight training that have come to me for their medical certificates. There are 3 different types of medical certificates. The first one is Class 1. Those are for the air transport pilots. So you think of someone who is flying a big plane, multiple engines with multiple passengers. So someone who's flying for United, for Southwest, for a big commercial airliner. The second class is Class 2. Those pilots are the ones that are doing commercial pilots, so spray planes, aerial applicators, aerial firefighters, corporate jets, med flights, so those sort of things where they're getting paid to fly, but it's a smaller plane. And then Class 3 is for your private pilots and to get a student pilot certification. So those are people who are not doing this to get paid, they're just doing it for fun. That would be the class that I would have, because I fly because I love to. I don't fly for money, and I have a great time doing so. So those are the 3 basic classes of flight physicals. Now once you have had one of those, you would qualify to do what is called basic med. And basic med is not a flight physical that's done by an aviation medical examiner, but it's one that's done by your family doctor. And those are physicals that just came out in the last few years for private pilots that don't want to go through an AME since there's so few and they're sometimes hard to find and hard to get in with. If you're just going to be flying in the contiguous US and you're not having a complex airplane, you're just flying a small airplane with your friends, 6 seats or less, then you can do basic med. But you first have to have a class 1, 2, or 3 before you can downgrade to a basic med. And if you're interested in that, do talk about it with your family doctor, because that's who is supposed to be doing it. It's supposed to be someone who knows you and knows your medical history well to make sure that they think that you would be safe to fly an airplane. So with that, there are some doctors that don't feel comfortable with that because of the different things that go into flying an airplane. We think about this when we're at altitude, there's different air pressure, so the air is thinner. So the higher you get, you could exacerbate problems, especially with breathing. So someone who has asthma, someone who has emphysema, someone who has had heart problems in the past, all of those could get worse. So we need to take that into consideration, because little planes like this one are not pressurized like the large commercial jets. Now, I'm definitely not getting anywhere near a United plane when I'm flying in this one, aside from when I'm getting close to land and they're landing. But that is something you have to take into awareness, because if you get too high, the air gets too thin, you can get what's called hypoxia, which is a decreased amount of blood going to the tissues, and that can relate in loss of consciousness. And that's a very bad thing when you're flying an airplane. So we want to make sure that everyone's healthy enough for their heart, for their lungs, to fly in an airplane, and that's where my job as an AME comes in, is to make sure that you are. Because when you're flying an airplane, you can't exactly pull over to the side of the road and get out if you have a problem. If you have a problem, you are in the air and that becomes an in-flight emergency. And if you're the only pilot on board, that's kind of a big deal. So we want to make sure that if there's any in-flight emergencies we could prevent or mitigate the risk for, we want to do that. So there are 10 main disqualifying conditions that the FAA has that says, you know, if you have these conditions, it's probably not a good idea if you fly. And most of them are related to heart issues, are related to seizure disorders, are related to uncontrolled depression or psychosis. So we basically don't want anyone in an airplane that could hurt themselves or hurt others with their flying. Because the last thing we would want to do is to have an in-flight emergency or someone use a plane to intentionally hurt themselves or someone else. So that's where those main 10 conditions come into play. Now, if you have one, say that you had a seizure when you were 5 because you had a really high fever, the FAA is going to look at that and say, we need more information. You know, was it truly only one time when you were 5 and your temperature was 104? That's no big deal. If we can get records from your doctor to, you know, substantiate that, to say you've never had any problems, they will probably say, you know what, we can issue you the certificate and we can get it to you. If you had a seizure 2 weeks ago and you come into me as an AME and say, hey, I would like to get my flight physical, I'm going to say, I politely have to defer. And a deferral doesn't mean you're never going to get your certificate. It means I can't tell you yes right now. The FAA is going to need more information. So they're going to get information from you. They're going to get information from your physician. They want to get a copy of your medical records. And then they're going to go over that with a fine-tooth comb to make sure that you can fly safely. And their goal is to get people flying safely. And 99% of the time, we are able to get pilots that want to fly, able to fly safely. We may put restrictions like you cannot be the pilot in command, or you cannot fly after dark, or you cannot fly when we need to use certain light signals. So there may be restrictions on what you can do, just like we have restrictions for people driving. I've a lot of pilots, the main restriction I put on is must have your glasses. So as long as we can get you seeing, hearing, and know that there probably won't be any foreseeable loss of consciousness, heart, or lung issues, most of the time we can get you certified. Now, if it does have to go to FAA, unfortunately, it does take a long process, and it can take 3 to 6 months to hear back from them and get that approval. The good news is that doesn't prevent someone who wants to fly from flying, it just prevents them from flying by themselves. So I see lots of students that all of a sudden want to fly, say, hey, I've got this history of asthma, I need to get information from my doctor, I have to get a lung function study, I have to show records of the medications I'm on. I can't issue them right away because they don't meet all the criteria, and then I have to wait. That doesn't mean they have to put their flight training on hold or their career and education on hold. It just means they can't fly by themselves. If they're in the plane with an instructor, that is completely safe and fine because there's someone else watching and able to take the controls from them should there be any issue or an emergency while in flight. So the AME's job is basically make sure you're healthy and happy, and I love to get pilots in the air and help them any way they can to make sure that they can fly and fly safely. My biggest rule of thumb is, would I get in the plane with this pilot? And if the answer is yes, then I'm going to do what I can to make sure that they meet all the criteria, and then I can certify them. Most of the time, the same day I see them, they can walk out with their certificate in hand. So it's a really fun way for me to share my love of aviation with other pilots. I always like to see pictures of airplanes. I like to show off the club plane that I get to fly. And we talk about our love of aviation. So my job's make sure they're safe, and we all have a great time and go off into the wild blue yonder.